So today is World Diabetes Day, raising awareness of the impact that diabetes has. Here in the Sultanate, of course, we have Oman Diabetes Association that spreads awareness and educating us on how to combat diabetes. So today we're going to talk about that with our guest, the head of Media Committee and Communication Committee of Oman's Diabetes Association. He is also a consultant pediatric endocrinologist at Sultan Qaboos University Hospital. Joining us on the line is Dr. Hussain Alsaffar to speak with us about the World Diabetes Day. Welcome to the show, Doctor, and thank you for joining us.
Hello?
Yes, hello. It's very good to have you.
Oh, hi. Thank you very much for the invitation. Yes.
Okay, wonderful. How is Oman Diabetes Association celebrating the World's Diabetes Day today, Doctor?
Yeah, well, as you know, this diabetes is a chronic condition that needs to pay a lot of attention, especially the number of people is rising. So the ODA has taken the initiatives to educate people today in a very well-attended public event in one of the biggest and newest malls in Oman, in Muscat Mall.
Okay.
So we are having a big event, more than 14 booths and stations. And people are just visiting and coming in and out and getting educated into what is diabetes and how to prevent it.
Okay, wonderful initiative. But before we talk about the involvement of the association, can you tell us, Doctor, what is diabetes and what is the impact of it or the effects to any individual?
Sure. Diabetes is one of the very well recognized and known conditions since some time. It's a chronic disease in which the person has high blood glucose, the blood sugars that is coming from breaking down of food, and that high glucose cannot be managed properly in the body, and therefore the effects will be arising because of that effect of high glucose. That could happen either due to inadequate insulin production, like in type 1 diabetes, where the pancreas, the organ responsible for insulin production, fails to produce enough insulin, or because of the insulin, the availability of insulin in the body is not meeting the body's requirement, especially in overweight and obese people, and this is what is type 2 diabetes mellitus. All these receptors and sensors are not working effectively as used to be in the past. So basically, the effect of this such high glucose can have a major effect on a number of systems in the body, mainly 5 systems. So the cardiovascular system, which is the heart system, and the vessels. So the arteries could have a condition called atherosclerosis, where the walls are hardened and the arteries are narrowed, leading basically to heart attacks and peripheral arterial disease, where the limbs will not get enough blood supply, could end up with gangrene and amputation, stuff like this.
So
kidneys, the other major system, can be affected, and long-standing can lead to kidney failure, and people will need dialysis and kidney transplants and stuff like this.
So
the nerves, the third major system, can be affected because of those small blood vessels that supply these nerves will be affected, and people will get numbness, a burning sensation of their feet, for example. They may lose this sensation, and people will end up with ulcers, and that's another leading factor for amputation. The fourth system can be affected, the eyes, and not uncommon for uncontrolled diabetic patients could end up with blindness. In addition, other conditions can be resulting as well, like cataract and glaucoma. Lastly, the skin and mouth can be affected because of, there is increased risk of bacterial and fungal infection when the person running high glucose, and that will be leading to poor hygiene, basically leading to increased risk factor for mouth infection and the skin infection, as well as we said earlier. So the impact is massive, and that is leading to a big burden, basically, to the healthcare system, as well as, the patients will be affected.
All right. So diabetes is not to be neglected because it has this dangerous impact.
Absolutely. It's 50% of type 2 diabetes is type 2 that's affecting the adults. It's preventable, yes. Absolutely.
Yes. So where can we get diabetes?
Right. So diabetes, it's a multifactorial disease. It's not just one factor. It's not like an inherited condition. So if your father having diabetes, then you are diabetic. It's not like this. It's a multi-factors. There is a genetic predisposition. There is some theories talking about viral infection can activate the immune system, and that will damage the pancreas, and that leading to type 1 diabetes. Type 2, basically, depending on lifestyle as well. So for people who have a sedentary life, not exercising, not active, eating lots of processed food or carbohydrate-rich food or junk food, they will be at higher risk of diabetes. Obesity is another major contributing factor to diabetes as well. So as I said, it's multifactorial, depends on which type of diabetes we are talking about. The type 2, which is a major type, and majority of people who are diabetic are type 2, they can prevent or reduce their risk factor for having diabetes by being more active, eating healthy, exercising frequently, and things like this. Yeah.
Wonderful. Thank you for sharing that, Doctor. You know, this has been an annual celebration also globally, the World Diabetes Day. What is this year's theme?
Yes, the theme for this year is diabetes, protect your family.
Okay.
Because we think the family are getting big impact from the diabetes as well. So what we are sharing with the world is that we need to, in addition to raising awareness and stuff, we need to get the families involved. We need to protect our family members from this disease.
Yes.
And if one of our family members is affected, we need to support, basically. We need the support can be taken at different levels, from like having a healthy food, a cooked food at home, trying to encourage our patient or our family member to check glucose frequently, to be adherent to the medication. And all of that is coming from basically education. So education until all the way through. So people need to be educated about this condition to be well supported.
Yes. Can you tell us a bit also about the Oman Diabetes Association and what is the aim of this association?
So Oman Diabetes Association is a non-profit health organization. Was established in 2005 by a group of endocrinologists and family physicians with interest in diabetes. We have a vision and mission. Our vision is to improve the community awareness of healthy lifestyle, patient education, and management of diabetes. Our mission is basically to prevent diabetes and endeavor to treat people with diabetes. We would like to improve the overall quality of life for our patients and to minimize the number of complications that could arise from diabetes.
Okay, and of course we salute you on this wonderful initiative. And yes, so let's talk about the celebration that you mentioned a while ago. So it will be a massive event later. Can you tell us about it?
It has actually started already, and people are in and out.
Okay, wonderful.
It started at 3.
Yeah, who are the people involved in the celebration?
Yeah, well, we are about 50 healthcare professionals.
Okay.
Between doctors, dentists, opticians, nurses, dietitians, educators, podiatrists, and technicians. And along us, we have about 14 volunteers. So even the healthcare professionals, they just finished their day job, and then they came to this event after a long time of planning and things. So, as I said, we have a number of professionals, and therefore, during this event, we got stations for public to come and meet the doctor, for example, if they got questions, to meet someone to measure their glucose or blood pressure. Another station to measure, to let them know what is their growth parameters, and therefore the body mass index, which has got a role on as a risk factor for diabetes, is increased. We got a station about just about education, what is diabetes and how to prevent it. Another station for technology, about feet health, about the medicine use, about healthy diet, about oral health. We got an interesting station at the end about, in addition to entertainment for kids, we have a quiz and prizes station.
Okay,
so just encouraging people to come and and join us.
Yes. Well, now is it okay to come? Are you still open there?
Yeah. We are open till 9 p.m.
Till 9 p.m. at Muscat Mall.
Yes, that's right, yeah.
Wonderful. So that is an event commemorating the World Diabetes Day. So great. I think this is important as well, Doctor. How can we, as an individual, a family member, how can we raise awareness about diabetes?
Excellent question. That's a very good question. Mm-hmm. Right. Like any other condition, we are saying prevention is better than treatment.
Okay.
Correct? So if we know what are the symptoms and signs of the disease, for example,
okay,
or if we know what are the risk factors, then these things that we can work on. I cannot change my genes, mm-hmm. but I can play a factor on, for example, having a healthy diet, or, for example, being active to minimize my risk for type 2 diabetes.
Okay.
If I witness one of my family members with symptoms of diabetes, like drinking plenty of water, going frequently to the toilet, losing some weight, being tired and inactive. So that's a sign of to go with diabetes type 1. So I will get this family member to get the glucose checked as early as possible, rather than leaving things to complicate it and stuff, and then therefore the outcome will not be as great as if you detect something at early stage.
Right.
Because if you treat at early stage, the outcome is much better than a later stage. Therefore, by doing this, by encouraging people to have regular exercises, and you know, all of that could contribute to minimize the number of the affected number of diabetes, or to reduce the burden on hospitals and healthcare centers by reducing, you know, the number of people who are going to be hospitalized or being sick and unwell for long times is being left untreated.
Yes, wonderful. I think you mentioned some tips already, but that's what I want to ask as well. Just in closing, can you share some, you know, tips, healthy lifestyle tips, and how can we prevent and cure diabetes?
There are a number of researchers doing lots of work about new models of treatment of this condition. So perhaps we can leave that to later on, maybe if we can talk about the research in diabetes and other occasions. Sure. In terms of the tips regarding a healthy style, so we would encourage people to be active for at least 30 minutes, 5 times a week. And when I say active, that means, you know, that you've been active till you get sweat. That's when you get the heart pumping so hard and circulating throughout. And that means an active person. So 30 minutes, 5 times a week, that's 150 minutes a week, or having 10,000 steps every day. These are the most practical tips I would advise for keeping a healthy style per day.
10,000 steps?
Yeah, 10,000 steps per day. And we know, you know, these smartphones these days that we are carrying help us to measure the number of steps that we walk in. So it's easy these days.
Well, thank you so much, Dr. Hussain, for joining us.
You're welcome. Thank you very much for this interview.
Yeah, it's a pleasure talking to you, Dr. Hussain. We wish you all the best.
Pleasure.
And Oman Diabetes Association.
Thank you very much.